Wired for Wonder. Activating the child's brain with truth, emotion, and strategy. This mini-series blends neuroscience, emotional intelligence, and practical ministry-aligned strategies to transform how caregivers and educators steward the development of children's minds, especially those marked for legacy, healing, and spiritual transition. Real-life example of T-Health in action. T-Health in action. Real support, real connection. At Maryland Center, technology isn't just a tool, it's a lifeline. We use it to break down barriers and bring families, caregivers, and professionals together. One of the best examples of this is T-Health, where telehealth meetings help families get the care they need without the stress of travel or long wait times. Recently, we saw this in action when Sharon led a powerful T-Health session. It showed how virtual support can create real change for families. Let's hear what happened. Making sure all families have access. These programs are clear, but how do we make sure every family can access them? That's a big challenge. According to the CDC, preschool enrollment in both public and private programs has dropped to the lowest level since 2005, especially after the pandemic. Many preschools have closed, and families are having a hard time finding the right place for their child, especially if their child has health or developmental needs. Maryland is one of the states with the biggest drop in preschool enrollment. So we need to ask ourselves, what can we do, as educators, leaders, and community members, to make sure families can enroll and get the support they need? One idea is making sure children get meals during the day, like breakfast, snacks, and lunch. Some healthcare organizations have even added food pantries for enrolled families. We also need to think creatively about other supports, like transportation to and from the center. When we remove these barriers, we make it easier for families to say yes to early education. Removing barriers and making care easier. One big challenge for families is getting to the center. It's not always nearby, and travel can be hard. If a child has special medical needs, parents often have to miss work or pull their child out of preschool for appointments. Sharon gave a great example of how telehealth, virtual doctor visits, can help. If we can connect doctors to families through the center, even while parents are at work, the child still gets the care they need without missing school. Another helpful idea is home visits. Years ago, early childhood programs included home visits, and research shows they help kids attend school more regularly. Some centers are now thinking about bringing those visits back. We also need to make programs affordable. Infant care costs a lot, and many families struggle to pay. Offering financial help or subsidies can make a big difference. What does at risk mean? When we say a child is at risk, we're talking about things in their life that could make it harder for them to grow up healthy, strong, and ready to learn. These things aren't always about the child themselves. They're often about the environment around them. For example, think about where a child is born. Did they have access to good medical care when they were born? Live. Is their neighborhood safe? Is their home stable? Learn. Do they go to a school that supports their learning style and needs? Play. Are there safe parks or places to play outside? Worship. Do they have a place where they feel spiritually supported? Grow up. Are they surrounded by people who encourage them and help them succeed? To doctors or teachers, it can affect their health, emotions, and learning. They might not get the food, safety, or support they need to grow well. Being at risk doesn't mean a child is broken or hopeless. It means they need extra support, and when families, schools, and communities work together, that support can make a huge difference. We also pay close attention to what's happening in the child's home. A family's situation can have a big impact on how a child grows, learns, and feels. If someone in the home is dealing with physical health problems, like chronic pain or illness, or mental health challenges, like depression, anxiety, or stress, it can affect the whole family, especially the child. Children are sensitive to what's going on around them. If a parent or caregiver is struggling, the child might feel worried, confused, or even responsible. They might have trouble connecting with others, expressing their emotions, or feeling safe and supported. These challenges can make it harder for the child to focus in school, build friendships, or feel confident in themselves. That's why it's so important to support the whole family, not just the child. When caregivers get the help they need, it creates a healthier environment where children can thrive emotionally, socially, and spiritually. Stay tuned for more information on how our children's brains develop. If this ministry has stirred your spirit and these teachings have blessed your life, we invite you to subscribe to our YouTube channel at Apostle Stephanie's Great House. Share it with others who are hungry for truth and transformation. Your support helps us reach hearts across generations, building faith, shaping legacy, teachings, and spreading the word in unforgettable ways. Thank you for your support.